Hello, everybody. Dr. Ife Emenaha here today to discuss heart failure. In this channel, our goal is to arm you with the information, skills, and knowledge you need to help you care for any chronic condition that you may be diagnosed with. You will have the knowledge and the skills to be able to challenge the condition and still live a very nice and good quality of life. Okay, today, heart failure. What does that mean? The name is not exactly what it is. It's like when they say heart failure, that means, oh, there's no hope. There is hope. Heart failure means that the heart is not able to pump effectively and efficiently enough to be able to deliver blood that the body needs to function. So when this happens, that then means some organs will begin to suffer. The statistics on heart failure is that about 6 million people in the US battle with this condition. 1 out of every 5 people, they say that they project will have this condition, heart failure, in their life. And then, of course, the 2 hospitalizations every minute is related to heart failure. But once we take all these things that we share in this discussion in advisement, there should be some improved outlook and outcome. That's our hope. Let's do a little recap on the functioning of the heart. The heart is a hollow muscular organ. It is situated in the chest cavity. It weighs about 11 ounces and the size of a clenched fist. It has 4 chambers: front chamber, receiving chamber, 2 back chamber, which is the pumping chambers, the ventricles, and the receiving chamber is the atrium. 2 is atria. Now, the heart is divided by a wall, one half, the other half. The right side, the left side. The right side of the heart does not communicate with the left side, even though everything, so the blood on the left doesn't mix with the blood on the right. But when the heart pumps, the pumping chamber pumps together, the receiving chamber receives together, everything works in sync. It is such a beautiful, intricate work of God. Now, people with heart failure notice that their heart is not able to pump as effectively as the other person. The right side of the heart carries mostly oxygen-poor blood. The left side carries oxygen-rich blood. So when the right side is pumped out, it leaves to go to the lungs to pick up oxygen. Then when the left side pumps, the left side sends blood through the aorta to all parts of the body. Now, picture that this heart is not able to pump as effectively. That will be a backup. And when there's a backup, fluid is slowed down and fluid will start. Remember, in physics, it says movement goes from high concentration to low concentration. So the fluid will leave the area of high concentration to go inside the tissues where it has no business to go. So most of the symptoms you will see in heart failure is associated with fluid in all the wrong places. Okay. It is, we said that people with heart failure, they have other conditions such as diabetes, high blood pressure, chronic obstructive pulmonary disease, and even obesity. So the symptoms may overlap. But let's talk about the common symptoms we see in people with heart failure. Number one, swelling in the legs, ankles, and the feet. This is because fluid backs up and collects into these tissues. Clients may also have dry, hacking cough that doesn't go away. This is because fluid backs up and leaks into the lung. They may have trouble sleeping when they lie flat. The same thing, that is fluid back up in the lung. Okay. Rapid weight gain. Weight gain up to 2 pounds in one day. Maybe because they ate some frozen dinner or pizza or high salt food or some food or something that has reasonably high salt. You see that rapid weight gain because salt will draw water to itself, giving the heart increased workload that is already challenged. Another thing we see, the person in this condition will feel tired. Reason is because there is limited blood supply that is being sent to the arm, legs, and muscles. This blood is diverted to the organs that are more vital, like the brain and the heart. So you see the person tired. The tendency will be to do less and live on a heightened concern that if I do a little bit more, the heart may completely fail. No, that's not the approach. I want you to change your approach and know that you need to work closely with your physician and you will stay active. Your heart muscle, like any other muscle in your body, needs exercises. So we will do that. But we must do it with caution. You will talk with your physician and discuss what you can tolerate. Remember the word as tolerate, the phrase as tolerated. So the activity you will engage in will be activity that you enjoy and activity you can tolerate. Something like going for a walk in the block, for if that is feasible. If not, you can sit and stretch and do some seated exercises. If you can dance gently, you can put music and dance as tolerated. Talk to the doctor to make sure that what you're about to embark in is okay. Start with minimal activity and gradually progress. Again, as tolerated. Move up slowly and gradually. Experts suggest like 21 minutes a day. But you can break these 21 minutes into small chunks, like maybe 5 minutes or 6 minutes, 3-4 times a day, But make sure you do your exercises or activity at the same time. Match your activity to your health abilities. Join a group like support group who are battling with the same situation, friend, family. Support is important. Again, do what you enjoy, please. It may be time for you to learn new things that you may enjoy. Because they're saying heart failure doesn't mean that it's the end of your life. No, it can be the beginning. It's all what you make it. If for any reason you stop for a while, you go back. Give yourself time. Let's say you were at where you were exercising 15 minutes, maybe 2 times a day, but something happened. We weren't active for a while, then you come back. You have to start from like 5 minutes. Start back. Be patient with yourself. Now, another area that needs work is diet. Heart-healthy diet is important. We must modify our taste for salt. Eating less salt, water follows salt. And when this happens, it gives more burden to your heart. You don't want this. When you cook, use spices and herbs. And this will help you to use less salt and build your taste to tolerate less salt. Strictly check food labels. Avoid packaged and prepared food like frozen dinners. Also, avoid all this high salt food like bread, rolls, bagels, pizza, soup, sandwich, even poultry. And also, what then should you eat? You should gravitate towards veggies. Fresh vegetables are great. Green peas, green beans, dark leafy veggies, red, orange veggies like pepper, like bell pepper, and carrots. We need to eat fruits like apples, orange, pears, berries. Avocados are great. Whole grain food are important. Oatmeal, brown rice, bulgur wheat. Now, instead of poultry and all those meats, we can do salmon, trout, tuna, sardine. Now, nuts are good snacks. Walnut, sunflower, but please unsalted. We also need to eat pistachios and stuff like that. Okay. Olive oil is a good fat. Olive oil is good. Some people have also suggested the red palm oil. They said it has helped. So as you do it, talk to your physician and see what works for you. So hopefully this is some help to you. And remember, it is the will of God that you prosper and be in good health, even as your soul prospereth. That this pronouncement or this diagnosis is not the end of your life. You can turn things around. It can even be the beginning. So stay encouraged and stay upbeat. Thank you. Hope we have helped you. Share, like, and subscribe. God bless you.